What is up, my dudes and dudettes? I feel like I'm gonna sneeze. Good lord, this video's already starting off weird. So my battery's gonna die, and I really want to talk about this. It has nothing to do with dentures, but I guess it kind of could. Neuropathy. Now, neuropathy can happen to every single person on every single part of this planet. I'm talking about small fiber neuropathy, which is the small peripheral nerves inside of your entire body. Organs, skins and organs, so that included. But a lot of people want me to add that. It's everything. Now, my neuropathy could have been prevented. And this is why I tell you guys to advocate for yourself. Because somebody on my medical team, because when you have a PA, they only do like minimum of, well, max of 2 years of medical school. So they only treat the symptoms. They don't actually treat the problem. So I've had thyroid problems. I mean, the last time they actually checked and did their job was when I was pregnant with Thomas. And I had no thyroid hormone. It's a 0. No TSH level. Why can't I ever say that fast? No TSH level at all. All my other stuff was nothing. So I was having a problem since then. And which is when it can start for women. Now, I've been showing symptoms like, by the way, thickening of the skin. Check. Swelling so bad that you end up with 47 pulmonary embolisms. Check. My voice keeps going in and out. You guys know this. You can hear it on my freaking videos. Luckily for me, I have video footage of how much I've changed because of the thyroid. And iodine is important, guys. Please make sure you're adding iodine to your diet, whether it's multivitamin, which has it in there. You could do an iodine multivitamin itself. Don't ever do more than 150, guys, because if you don't have a problem, don't cause a problem. It was a lot of shit that could have been prevented. I could have been healthier. I could have went back to work. I could have did all that. If people were smart enough to know not to treat symptoms, to find the problem. And I begged my doctor for years. I begged her when I was going through clots that I just couldn't walk anymore. My whole body blew up like a puffer fish, and I don't know why. And instead of her figuring out the problem, she's like, oh, it's your anxiety. Girl, wasn't my anxiety, boo-boo. I started 3 days before I ended up in the hospital with my lung collapsing. Start there. But small fiber neuropathy, guys, can happen to anybody. Whether it's diabetes, autoimmune. Now, remind you, diabetic neuropathy is not the same. Don't ever think fibromyalgia is the same. It's not. Fibromyalgia is just the nerves you have are overactive in certain spots. Can it be painful? Yes. Athletes get it all the time because they're overusing stuff every minute. If you underuse your body, it will also cause neuropathy issues. That's why exercise is important. I'm not telling you to go out and be an athlete by any means. That's hard work. But do what's right for you and your body. Because even when I was going through the shit that I was going through, laying around, it's going to hurt more. Because now you're having muscles disappear. Muscle atrophy is just insane. And when you don't use them, they go away. So people are like, oh, I lost weight. I'm like, no, boo-boo, you lost muscle. Big difference. How do I know I've been there? Check my videos. You'll see the difference. People like, oh, I was diagnosed with it. I'm like, oh, how were you diagnosed with it? EMG. EMG does not diagnose it. It could diagnose neuropathy, but not exactly what neuropathy. I mean, dude, I had that thing all the way up my back. It was so fucking painful. I hate EMGs. EMGs suck. But small fiber neuropathy biopsy is the only way to find out, guys. And it's a dual biopsy, one on the right hand, one on the left ankle, and vice versa. And they check the opposite ends of the body to see if you have neuropathy just in your feet, or say up top, or both. Mine was a super fucking high positive. Now, my thyroid problems caused it. They originally thought it was my autoimmune disease. With all the research I've done, boo-boo, no, it was not. But a lot of people, the reason I'm doing a neuropathy one is a lot of people watch my old videos that had nothing to do with dentures. When I talk about, Linzess or small fiber neuropathy, stuff like that, those are my most popular videos, was medical, not dentures. And, I mean, I've had Linzess contact me, the company itself. Apparently I didn't fit the mold of what they were looking for. Great. But, small fiber neuropathy is, God, I can't even explain the pain. Some people get like the bugs crawling thing. To me, that's psoriasis-like syndrome. That's a B. We'll just say that. But small fiber neuropathy, man, it's painful. I also get electric shock going from my lower back, no, not my lower, my mid back to my neck or my neck down. Because I also have neuromyelitis optica. So I never know if it's neuropathy or I have a rare, severe form of a type of MS. It's like the ultra rare. Like 1,000 people in the world have it. Kind of ultra rare. Like, it's like, what? I never heard of that. So I just tell people I have a form of MS because every time I say neuromyelitis optica, they're like, what? So you have something wrong with your eyes? No. It's called optica because it affects the eyes too. Neuromyelitis, which is the spine. So it's spine, cranial, brain, eyeballs. That's why I'm legally blind. At least we figured that out. But small fiber neuropathy, there are ways that can help. First, get diagnosed properly. The doctor can't just look at you and say you have small fiber neuropathy. There's no fucking way. They have to do the actual biopsies. It's the only way to do it. And then there's large fiber neuropathy, which is they take a biopsy of your muscle. And I asked my doctor, I'm like, do you think it's possible to have large fiber? And he goes, oh, 100%. But he goes, I'm not putting you through that biopsy. He goes, Heather, you go into flare-ups now. We can't control your swelling now. Why would I take a part of your muscle and be like, well, I hope she's good? I mean, he's right. There's no logical way. And we already know I have one. So it's rare to get both, but I show all the symptoms and signs, so I probably do. And to me at this point, I just don't care anymore. I have so many things wrong with me that I don't care. I'm just fed up. But I do have to say, you have to be your best own advocate. I get when you're first starting out in this journey and all of that, you want to trust your doctors, everything they say, but they're not you. They're not your body. They don't go home at the end of the day and deal with your pain. They do not. They might have a headache dealing from patients, but they don't have your pain. So be your best own advocate. Do your research. See, I'm the type of person that I can do research without getting anxiety because I want answers. I want to be helped and fixed. I don't read something on Google and freak the fuck out. I'm just not that type of person. So if you are, I don't recommend you researching. But I just want answers. So I research and I go with them to it. And only me and my rheumatologist, we could sit down and go blow by blow what we think it is, what it could be, and then we have a plan. My other doctors don't do that. Plus, my primary is not a doctor. She's a physician assistant. She's just a PA. PAs cannot doctor because they're not doctors. They need 8 more years of medical school. I have not come across a good one yet. I'm going to be real. Their egos are pretty big, though. I'm sure there's some great ones out there, but nurse practitioners, they can have their own practice, but they know the triage part. They've seen everything. That's why I will always trust a nurse practitioner, plus they've always saved my life. Every time I ever had something wrong with me, they're the ones that saved my life, not my primary. Not anybody else. But if you think you have... Now, remind you, it's not just neuropathy pain. Small fiber neuropathy is your sensitivity to sun, UV rays, like you blow up like I do, and swell. It's a bitch. It's a lot of things. You can have excessively sweating, and in super rare cases, no sweating at all. And that's what I had until some things were figured out and I'm able to sweat again. Which, I went 15 years without sweating. I was fine. But because of my thyroid, it messed up my what the hell is it? How do I remember it every other time but not this time? Hypothalamus caused major issues where I was just overheated all the time. My body temperature could not regulate. I was not doing good. I was on fire, like literally fire from the inside out. My skin was like dark red all the time. Oh my god, I had to use freaking the garden hose because it's so cold. Put it on my scalp to try to cool everything down. You'd think she would have thought about it then. Nope. Of course not. I just kept suffering. But that's my point. Be your best own advocate. Don't wait until something bad happens for you to do it. If you can do the research, do the research. If you can figure stuff out, figure it out. Talk to your doctors. Tell them, no, we need a plan. We can't just be like, oh, I'll see you in a year. No, boo-boo. We need to come up with something of what this could be and how to help me. See, I knew... They always said, hey, it was scleroderma because I had swallowing issues. It was my thyroid. I had swollen thyroid where it was when I swallowed. I would have major issues. So I always say if you have swallowing issues, get your thyroid checked. That should be the first one that should be done. I had sonograms done, but because she didn't know what she was looking at, she was just like, oh, you're fine. You know, the radiologist would have said something. That's not true. Radiologists miss shit all the time, especially in my facility. So yeah, I recommend you getting somebody else to read it that you can trust. Like, I immediately sent it over because I was done. I immediately sent it on my rheumatologist like she was supposed to for years and never did. And he immediately knew what it was, and then I figured it out of what exactly was causing it. And it's going to take months, but it ruined my singing voice. It ruined, you can hear the rigid and roughness to it. Dry mouth is bad. I have a split my tongue. Oh, if you have a swollen tongue, like your tongue is fat, it's another sign of thyroid issues. Mine was like fat. It's coming down. It's actually exciting. I have a normal tongue again. But I wanted to talk to you guys about neuropathy because so many people have misconceptions or just not educated for it. And I do believe there needs to be more education out in the world. There has to be. Because people are just thinking all neuropathy is the same. They're all not created equal, guys. And small fiber neuropathy can be deadly. In some cases. Not in most. Or even a quarter. But it's the peripheral nerves inside your organs. Cause organ issues like my gallbladder exploded. It can cause many things. So if you think you have small fiber neuropathy, if you have more than just pain, and if you look it up, it'll give you a rundown of all the symptoms. But there's a ton more symptoms. It's not just pain. Like when somebody says, oh, I think I have small fiber neuropathy, I was like, why? She's like, oh, I have pain in my elbow. I'm like, chances of that being small fiber neuropathy is like nothing, girl. That could be just, fibromyalgia. It could be just whatever. Small fiber neuropathy is like your pain is insane. And it's either your legs or your upper body or both. In my case, it was both. Because everything just started snowballing downhill. Like, it was a mess. But again, get a biopsy done. But I always tell people, just because you see this video, don't mean it's going to happen to you. Don't mean you have it. Doesn't mean anything. It's just educating people. Because people think, oh, neuropathy is the same. It is not. Like, when I get restless leg syndrome, it actually wasn't restless leg syndrome. It was my muscles spasming from low magnesium. And I mean all of my muscles spasm 24/7. But it's more noticeable when you lay down because everything's at peace. And now, I mean, you can feel the vibrating. It's freaking insane. Ugh. I'm on 600 milligrams of magnesium, and that's still ain't increasing my magnesium. So I'm going to have a conversation with my hematologist and be like, please do magnesium, like, infusions, something. My body's not absorbing it. Please help it absorb, because homegirl's sick of the cramps. Like, God darn, it's painful. But it's just crazy. I'm starting to find out more and more stuff with my health. And I don't want people to suffer the way I did. I don't want any of you to suffer the way I did. Nobody deserves that crap. You all deserve better than that. Be your best own advocate. No matter what you're going through, no matter if you think you have an autoimmune disease. Now, I tell people how I knew I had an autoimmune disease was, first of all, I didn't know this was a part of it. When you first start to get some autoimmune diseases, I had severe migraines. Like, I had Wonka vision, where, like, it was all that weird visionness. And I had flu-like symptoms. And I don't mean for, like, a month or, like, a week, because that's probably the flu. Or, like, just winter itself. But I mean, like, for an entire year, I felt like this. And I went from being such a hyperactive person, and now I'm in severe freaking pain. Migraines 24/7. Like, oh my God, it sucked. The beginning sucked so bad. And it's so crazy because now when I look up iodine deficiency, thyroiditis, those are all my symptoms. All of them. That she's treating them individually, but not as a whole, because she wasn't educated with thyroid. And that's the problem. People in my case should be seeing an MD doctor, not a PA, who barely even had a year or two in medical school. Real doctors have 8 to 12 years. So, And they have to do residency. They have to do all of that stuff. PAs are just physician assistants. They're just assistants. That's it. But if you guys have any questions, put them down below. I can answer you guys individually, because the list is forever of like what it could be. A lot of people think it's neuropathy when it's definitely muscle. Now, I mixed that up because it 100% felt like neuropathy. I mean, if you have diabetes, that can cause anything. Diabetes 2 is an autoimmune disease you basically caused yourself from overeating bad, terrible things. Diabetes 1 is like an autoimmune disease you're kind of born with. But most of the time it doesn't start to show until like you're about 8 to 14 years old, somewhere around there. It's not really at birth, so to speak, because you don't really eat sugars like that. And I know puberty sure as hell doesn't help. But there's no black and white answer when it comes to, or cut and dry answer when it comes to anything medical. Everything is messy. Everything has multiple symptoms. And autoimmune disease world, they all have the same fucking damn symptoms. I shit you not. I'm like, Jesus, no wonder why it takes you guys freaking years. It takes like 4 to 5 years to be diagnosed with an autoimmune. That sucks. But if you do have small fiber neuropathy, and you're seeing this after this video, Lyrica was a godsend. I do not recommend gabapentin. They've been battling whether to make it and fighting to make it a controlled substance, not like controlled neuropathy kind of thing, but like a narcotic, because it doesn't act like Lyrica does. It's a whole different ballgame, and to try to get off of that can put you in hospital. Actually, it has put some of my family members in the hospital. I will never in my life ever take gabapentin. I did it once, biggest mistake of my life, went to Lyrica, and that made the world of a difference. But remember, any new med that you guys start, you're going to have side effects, man. Everybody has them. That doesn't mean you're allergic. Oh my God, if I had $1 for every time I'd explain that to people. Just because you get symptoms doesn't mean you're allergic. If you have breathing problems, stuff like that, that's an allergy. But if you have like diarrhea, nausea, headache, that's just symptoms. When you put a new chemical into your body has to get used to it. It could take 2 to 3 weeks. And as the 2 to 3 weeks come up and you're consistently taking it, the side effects will go away. The only medication that never went away for me was Cymbalta. That actually worked great for pain, for like neuropathy, but it made me a zombie. And I felt so fuzzy and far away. And eventually my doctor's like, we need to get you off of this. Because it worked for pain. It really does work for pain. Which is crazy that it would work for pain. But something with the brain receptors, I have no idea. But I always recommend Lyrica because as a patient that's tried everything. Every medication is going to give you side effects, guys. It doesn't mean you're allergic. And it doesn't mean you need to stop it. Unless they're severe, moderately to severe, it's the only reason why you would need to stop a med. Other than that, they're just common side effects people get. And like I said, it's a new thing that went into your body. Your body's like, what the fuck? And then when it gets used to it, then all the side effects go away. So, that's how meds work. Please do not stop taking meds if they really do help you, but they're just giving you crappy side effects. Because it's a new thing in your body, man. You'll be fine. Like, I've seen people that are like, oh my God, I had a headache. I must stop it. Or I had diarrhea like once every 4 days. I need to stop it. No, you don't. Diarrhea once every 4 days? No, you're fine. If you have terrible diarrhea, like non-stop, it's just no matter what you eat, diarrhea, then yes, you need to stop it. But remember, there's different stages. Mild, moderate, severe. Depends on the person, depends on your body chemistry. It depends all of that. But just because you get side effects, don't mean you need to stop every med. That's not how that works. Because everything new to your body, it's like when you get a vaccine. Like say when you get the flu shot, people are like, oh, I got the flu with it. No, you didn't. It's just your body, when you put something new into your body, especially the vaccine, it's a dead virus. It's dead, bro. It's not alive. But it's trying to teach your body that you had the flu already to not give it to you again. And that's why if you do get it, it's mild or you don't get it at all. You can still get the flu with the flu vaccine. It just won't be nearly as severe without it. And trust me. I've only gotten the flu vaccine now starting for the last 8 years. Why? Because that the flu's so freaking bad. I felt like I was in labor with back pain. It was awful. Shitty. So, like my kids, they got the flu 2 years ago. They got the flu shot 2 weeks before they got the flu, which takes a month for it to fully go into your body. So they only had like half-life. They had it for 4 days, and it was mild-ish. So, yeah, they'll tell you up and down that they will never be late again on their flu vaccine. But it's just your body. Your body's like, oh, what is this new thing? Attack, attack, attack. That's what causes the tiredness, the achiness, and all of that. It's your immune system doing its job. And then after a couple days, you're fine. The flu, if you had the real flu, honey, that'd be like 2 to 3 weeks, not 2 to 3 days. And for somebody with an autoimmune disease, I get the flu-like symptoms. But again, it goes away in 2 days. So I think people, when they see the pamphlet that they start a new medication, they read it and they get anxiety and they panic and they stop the meds. But then I tell people, don't even bother with medication then if you're going to freak out, because that's not going to help you. Nothing's going to help you if you're going to stop it no matter what you do. You take it for a day, you stop. You take it for a day, you stop, a new med. Try this med. Take it for a day, you stop. That's like saying you can't take any medication? No. It's just, you're going to get side effects. It's going to be uncomfortable for a little bit. I'm trying to remember my Lyrica ones and I can't remember them. I know I had side effects, but she was like, give it 2 weeks. If it goes away, cool. If not, we'll change you out. It was gone within a week and a half, and I was like, nope, we're good. Keep us there, because I wasn't able to hug my kids. The pain was so bad. And with that medication, I can. And that is such a big... The depression I had was so bad. Lyrica gave me my life back for neuropathy, and I'm grateful for that. So, yes, it does help for small fiber neuropathy. There's no cure for small fiber neuropathy. Nerves just don't grow back. The peripheral nerves. They just don't. Even my doctor wrote that on the paper, sent it to my primary. Because she's like, oh, they can grow back. And he goes, no, they don't. He's like, good Lord. Word. But there are meds that you can do, like Lyrica. But I won't recommend gabapentin. If you want to try it, knock yourself out. But I've seen too many people I know suffer and regret ever knowing that med ever existed. So, I can only give out experience. You guys can do what you want with it. But if you have any questions, put it down in the comments. I'll answer them individually, because I got to do more research. I've had it for like 10 years now. That I do know that UV exposure makes you swell, causes more issues, almost like an allergy to sun, is one of the symptoms. But again, just because you have that doesn't mean it's that, because lupus causes it, RA causes it. Like, there's many other shit that can cause that, even Lyme disease. So you really got to do your blood work, do your research, do your biopsies. You just get everything done that you need to get done, and then you'll just come back with your doctor, sit down, have some answers. It's just the way it works. I wish I can get answers overnight. I would have been healed a long time ago. But I'm not. I'm here, and I'm stuck with it. So it is what it is. But I love you guys. Stay safe. Be your best own advocate. Pretend I'm with you in that room, being your best own advocate, because nobody feels what you feel but you. Later, guys.